Take it away.
Hello, everybody. So, yeah, my name is Jacob Handel. Um, where do I begin? Let's see. So, my teenage years, I grew up in an affluent community. I was upper middle class in a very wealthy community, and there was a lot of partying and stuff, and I had some hardships I went through. My mother passed away when I was younger, which kind of led me into like self-medicating. And, it went from like socially drinking, and then, I went into opiates. And that led me to, start smoking opiates and heroin off tinfoil, which what led me to my disease I got. So essentially it's called toxic acute progressive leukoencephalopathy, which is a traumatic brain injury caused by inhalation of a toxin. So they're not sure what this was, but odds are a pesticide. Anyway, I would smoke this stuff on a daily basis, and I'm doing my normal routine, going to work, and something's just off. And it started with the slightest alterations in my speech and motor control. Anyway, that led me, I don't know if you saw my blog, but I go into more detail there, but what actually happened, it led me going to the emergency room, and I was diagnosed with toxic acute progressive leukoencephalopathy. They kind of laid that out for me. They were like, you can survive this, but it is a progressive disease. It's only gonna get worse. And they were like, you're gonna not be able to walk within a month. You're gonna have difficulty even sitting in a chair in a few months. Then you'll start having dysphagia, difficulty swallowing and speaking, and possibly end up in a coma and die. And they pretty much gave me like a 6-month time period. So, that was obviously tough to hear, but I took it. And at first, the first day I went through like denial, and I was just like, I'm gonna continue abusing drugs. Like, what's the difference? And then I thought about it, and I was like, I'm gonna fight. And if anyone could survive, it might be me. So I stopped everything. I was put into rehabilitation pretty much right away within 3 weeks of diagnosis. I was on a rapid decline. I started getting introduced to thickened liquids. It was getting really difficult to eat certain foods, probably within the first 2 months. You know, anyway, I'll fast forward to October of 2017. I could barely walk with 2 people maximum assist, essentially dragging me around. And that was one of my last days outside. Then I was totally bedbound. He put me on a feeding tube, tracheotomy. I could not communicate. I lost the ability to communicate by, all nonverbal, like blinks and sticking out my tongue. Ironically, my way of, when I broke out of locked-in syndrome, was the same way that, it happened while I was getting sicker. So, okay, so I getting into this coma-like state, and it was weird. It was like, no one around me in the hospital was acknowledging me anymore. Like, normally a nurse would come in and be like, "Good morning, Mr. Handel. I'm here to change your IV bag." But instead of that, there was like no interaction whatsoever, and I was wondering why. And when there were doctors initially there speaking with some family, you know, it was like I was not even in the room. And that's when I started to realize, like, wow, no one knows I'm still inside my body here. Like, it's crazy. So I didn't realize I was actually locked in for like 2 weeks. And yeah, so that lasted a long time. You know, they said it would die several times. It never died. I was put on hospice because they didn't know what to do with me. Um, Hospice was really rough. I was in severe pain. Feeding tube diet, you know, everything was horrible. Talking to myself. And I still didn't die. I lasted 6 months on hospice and eventually timed out of hospice. And they didn't know what to do with me. So they brought me back to MGH, where I was essentially put on an internal medicine floor because they had no idea what to do with me. So around July 4th of 2018, someone noticed a minor wrist movement. And when I say minor, like a micro movement of my right wrist. And they were like, "Do you guys see that?" And the other doctors on rounds are like, "Yeah, it's gotta be involuntary." And someone was like, "Well, I don't think so. Like, this is new, so let's like monitor him." And they brought in a speech therapist whose sole goal was to get me to try and blink, and that started to happen. And I started to be able to blink, and they were like, "Blink if you can hear me." I'd blink. They're like, "Blink if you know where you are." I'd blink. Um, so they were still unsure if I was really cognitively there or to what extent. I would have to ask them to like really get a better sense of what they thought back then, but pretty sure the expectations were not great. They were like, "This is interesting," but they couldn't have foreseen what was to come. So a real pivotal moment here was the same speech pathologist, you know, was like, I think they read in my chart, or one of my family members told them he used to stick out his tongue for yes. So they were like, "Jake, we're gonna try and get you to stick out your tongue." And like, imagine if you're trying to bench press like 500 pounds. That's what I was trying to do. And she was like, "Come on, stick out your tongue." And I'm like, I can't do it. And all of a sudden I hear, "Okay, that's great, that's good enough, that'll be your yes, blinking will be your no." That's when it crossed over to being virtually locked in. So I had a yes and no system. Within the same month, by July 21st, they introduced me to a letterboard, and they were kind of explaining this to me like very slow. I fully comprehended this, and it was just a simple AEIOU board, and I was able to like spell out something, not super quickly, but like compared to just like nothing, it was a wonderful gift. So they they were like, it started off with like, I think the first thing I said was just hot, because it was extremely hot. And then they asked me a few questions, and they realized, or started to realize, I was able to follow along with the conversation. So then they start talking about bringing me to some ATEC department, either Boston Children's or Spalding, to try and get me a eye gaze tracking system so I could really speak and or non-verbally speak, and they start talking amongst themselves. The issue would be that I would never meet the requirements because I could not participate in 3 hours of therapy a day. I start like freaking out, blinking, sticking out my tongue. Luckily, the speech therapist was there. It was like, calm down, Jake, do you want to use the letterboard? And I spelled out, I think it took me like roughly 8 minutes. I can do 3 hours a day. And that was a moment when they were like, okay, not only can he understand us, but he is actually tracking our conversation. So shortly after, I think July 28th, I was brought to Spalding Rehabilitation, where I met Michelle, and there was some confusion on my why I was a rehab candidate at first, but she investigated by calling the previous therapist and figured out my background story, and then all this stuff started happening. So the letterboard is really in place for bare essential needs, and Michelle introduced me to something called the Megabee because my iris on my eye could not properly track an eye gaze system. And so with this Megabee, at first I thought this was gonna be slower, and I was pretty good at it. I got the concept, but I was like, I think it'll be faster. But Michelle kept stuck on me and was like, trust me, once you get this down, once we educate the staff, you will blow through paragraphs. I was finally able to communicate with family. Me and Michelle had some pretty heavy conversations. I actually got Michelle trained a psychologist on how to use this device so I could participate in therapy, and that was huge. It was first time I communicated effectively in over a year at that point. And so let's see. So Michelle and I did some swallow studies, some vocal cords. I was MBO my entire time there. We started trialing some smoothies and pureed foods, but very small amounts. So I make huge gains in terms of they were small, but they were big in comparison. So, I get transferred around, I believe it was September 13th, 2018, to Western Mass Hospital. And that's, around end of December, beginning of January 2019 is when I started making vowel sounds. And I made a few sounds and words with Michelle, but it was never consistent. I think it happened on 3 occasions. But starting in January of 2019, I started getting my vowels down, started working on blends. I started working from feeding tube to putting thick water to honey to nectar. Same with the food. I went from puree to ground to chop. And then, movements start to happen. I was completely paraplegic. I only had minor movement of my neck at this time. I'd say by probably March, I was able to move my arms and like minimal hand movements. And by May, my entire body was anti-gravity, meaning I could like move every limb, I could bridge, etc. Let's see what else. I think, Michelle, maybe you can direct me in where I should go from here.
Well, I just want to point out that I hope it's clear how informed Jake is about obviously his own medical history, but even what he was working on in rehab and why. He's basically like a speech therapist, the way he just talked about his goals. I want to give a little bit more background on the goals that we were working on together, and then maybe you can talk a little bit more on the goals that you worked on with your speech therapist in the next facility. Um, a few things
Sure.
point out is that, you know, when the speech therapist in the acute hospital noticed that Jake was blinking, you can't take for granted that the blink is a consistent and a reliable response, because sometimes people who are unable to communicate verbally also have a significant language impairment. So you might say, blink if you understand me, and they blink, and then you say another question, blink if you're the president of the United States, and they blink again. And so clearly the understanding isn't there. So I think it's important to note that the speech therapist at the acute hospital noted that he was able to communicate in some way. And then I'm sure she had a system for confirming that it was a reliable and consistent response, one that could be trusted. So when we say, Jake, are you in pain? And he blinks, we know he's actually in pain. He's not just blinking because he doesn't understand the question. Did she do any type of test of that you remember, Jake? Test of your reliability of your response?
Yeah, so they would try and trick me up. They'd be like, blink if you know where you are, like blink if you know the president, don't blink. I wouldn't blink.
Right.
And they kept trying to trick me up and they never could. So I remember other people were watching, they were like, yeah, this doesn't seem to be involuntary.
Exactly.
And I'm just like, you know,
Yep.
yeah. So there was definitely like a 2-week period of this to like reconfirm I knew what I was in there.
Yep. And that was actually one of my jobs when Jake came to the hospital at Spalding. Was, we had this patient that was only communicating by blinking and sticking his tongue out, and all of the doctors kind of wanted to know and were coming to me saying, what does he understand? What does he not understand? What does his cognition look like? And so after I had established this way of communicating with Jake, then I had to kind of come up with a way to assess his language skills and his cognition skills in a really modified way. And I believe it was about 2 weeks in that I was able to fully assess Jake for his language and cognition. And I remember kind of having a conversation with him after and saying, oh, you're totally in there. You're 100% here. And he kind of looked at me and laughed. And
I remember that. Yeah.
So with what we were working on when he was with me at Spalding is I was trying to figure out why he wasn't making a voice. I didn't know if his vocal cords had been damaged. So we did we scoped him to look at his vocal cords, and his vocal cords were moving perfectly. I did a video, and so what I thought was going on with his voice was a lot of respiration, phonation, breath support. So we did a lot of breathing, a lot of diaphragmatic breathing. Jake was so apraxic and at the time that he couldn't coordinate his breathing. And so we did a lot of breathing to support the phonation. And then as he described, that built onto making sounds and then shaping a vowel and then the articulation of actual words and complex sounds. Did you want to say something, Jake?
Yeah, I want to add one thing to that. Yeah, just to make or even attempt to make a single sound with you, it took everything in my body.
Oh my God, I know.
I started complaining about foot pain because I was in serial cast, and I literally thrust my leg. And even after you, Michelle, my next speech pathologist, even when I could make noise, I would have to like kick my leg to actually get the noise. So this is like how much effort it really took to force out a sound. And yes, we definitely worked extensively on diaphragmatic breathing. I remember getting like nauseous and dizzy at times from this.
Yeah.
My lungs capacity, they were so weak that taking like 5 deep breaths, which really would be like a shallow breath for a normal individual, was, I mean, so tolling on the body, it could like literally ruin my whole day.
Yeah.
Um,
I do remember I pushed you hard a little bit one day and you felt really sick and I felt badly. I was like, ooh, maybe we went too far. But we were working, you know?
I mean, it was for the best,
Yeah.
obviously.
So we worked on his breath support and his phonation. We did work on his swallowing. Jake actually just shared with me today, he found his records of the video fluoroscopic swallow study that I ran on him. So I'll share with you the notes. Whereas basically we do an x-ray of his swallow and see what's going on orally and pharyngally. And you're going to have a whole other module on swallowing where you learn the ins and outs, but this is another element of care and rehab, where you try to understand what's happening inside during the swallow that's making it unsafe. And so you're looking to see if there's penetration or aspiration. Penetration is when liquids or solids go, in between the vocal cords. Aspiration when it passes through and goes into the lungs. These are all things that you're looking for in this type of study. So we did this video fluoroscopic study and decided whether it was safe for him to eat or not. At that time, he still stayed NPO. But we practiced, different textures of liquids. Also positioning was an issue at the time. It was really hard for Jake to remain upright for longer than, 5 minutes. And then you had to lay down again. And then it was a lot of working with the Megabee and making sure Jake was a pro, making sure educating his care team, all of the nurses and doctors and caseworkers and everyone that was communicating with Jake, that they knew how to use this system so that he could communicate quickly and efficiently. And it moved beyond.
That was a huge part of your job.
Mm-hmm. And then I'm trying to think, did we work on anything else? Am I missing anything? Sorry, I'm gonna shut my video off.
No, I mean, you're a little broken up there, but no, that's about it. I mean, I can go into stuff I did after I left to you if you want.
Talk about that a little bit.
All right, so, it was the same thing in the beginning because it got there September 13th, 2018. So a lot of diaphragmatic breathing stuff. And then my face had zero expression at the time. What do they call that? Like
Flat
something
affect.
effect, flat effect?
Yeah, flat affect.
Yeah, so I had no idea. She showed me myself in the mirror one day and I was like, oh my God. So if I voluntarily, if something actually made me laugh, I could smile and laugh even before I could make real phonation. But then if they were smile, nothing would happen. It would be my best way to describe it is a stroke face. Yeah. So, half of our hour-long speech sessions at Western Mass were to work on exercising facial muscles, and the other half was diaphragmatic breathing until it got to the point of making oohs and ahs. We stayed with the facial exercises as a warm-up for maybe only 10 minutes, which clearly made a difference. I mean, it's not great I'm looking at myself in the camera, I'm like, but it's a lot better than it was even like a year ago. So we went from oohs and ahs to like the vowels, and then I think, something I worked on with you was saying I love you. So that was something I really wanted to tackle. I was able to get that down. Now it's like other individual words. We started specific blends. I know STs were tough. I know P's and B's sounded the same. Is that exercise called non-parables?
Why am I blanking? It's minimal pairs. Minimal pairs.
Minimal pairs, yeah. So she'd be like, you know, inappropriate reference here, comment. One thing she would be like, say pitch, and I'd be like, bitch, and she'd be like, say bitch, and I'd be like, bitch, and we'd record them, and they would sound the same. So like my P's and B's were, that was something I didn't master for probably a year. I mean, I still haven't mastered any of this, but getting there. So sound blends, a big part of it, once I was able to speak at the sentence level, was fatigue. So even though I didn't feel like I was tired, after like an hour of talking, I would notice like I could barely communicate, and what I could communicate would not be intelligible. So I like get out of speech and make a FaceTime call, and within like by 10 a.m. nurses would be like, "What do you need, Jake?" And I'd be like, "Blah blah blah," and that's just how it was for a while, because I was just not physically tired, I guess, but like so mentally exhausted that my speech would just fall apart. Very, very bothersome and difficult. But then about a month later, I would notice that it would be good, like right when I woke up in the morning through speech, maybe an hour after, and it would come back late at night, which we were like, interesting. And then over time, and I did like a lot of practice on my own, and my speech therapist like tape exercises on my walls, and I just did this stuff all day long, like practicing the blends I was bad at and just talking. And I would talk to my iPad. I probably sounded like a crazy person, but then again, in long-term care, I probably fit right in. But I was, I remember trying to sing, and must sounded funny. As of right now, one of the main things I'm working on is inflection, prosody, tone of my voice, which actually has come a long way. Actually, I got diagnosed with coronavirus in April, and ever since I've recovered, there's been more tone differentials in my voice, which is really another anomaly. But with my case, fits right in. I guess my laryngologist, a Mass Pioneer, was like, "Yep, I haven't noticed this, but I'm like, so is this like very weird?" And he's like, "You're weird, man. Yes, this is very weird." So yeah, so I do a lot of, back before coronavirus, I was using the app called Constant Therapy to practice on my own, to get like additional therapy, and so much more mobile and can use my hands, that I'm like on my iPad all day. I'm reading poetry and trying to create like inflection, and yeah, so that's where I'm at now.
I love it. I love
What do
it.
you
I
think,
love hearing
Michelle?
you're reading
Q&A time?
poetry. I did not know about the poetry.
I just started, yeah.
Okay.
And another thing my primary care doctor told me to do is like, you know, for a while I was trying to see how many numbers I could count out loud in one breath. And I got up to like 38 at one point. He's like, okay, now it's time for you to like see how many words you can spit out of one breath. So, I'll be like, the lazy dog jumped over the brown fox jumped over the lazy dog. Sorry, apparently I'm dyslexic now. Yeah. So yeah, I'm doing poetry now. This is my new thing. And I'm about to start LSVT voice therapy, which I don't fully understand yet because my eval is November 8th, COVID permitting. But I don't know. I know there's a lot of equipment involved and they're gonna measure like megahertz or whatnot.
That'll be interesting. I'm
Yeah.
looking forward to hearing
I
how
don't
it
know.
goes.
But I'll tell you about it when it happens. Yeah. Very exciting stuff. So is there anything else I should touch on?
Well, let's pause there for a minute. First of all, thank you for
The
sharing.
bubbling.
I do feel like
You're very welcome.
you're a budding speech therapist in training. You're actually like a very experienced speech therapist now. So now I wanna I wanna open it up to the class.
And physical therapist and occupational.
Yep. Yep. So there's a lot there. There's so much there.
Yeah.
In Jake's story, and this is now your opportunity, everyone, to kind of think about it, ask him about it. And Jake has always said he's an open book, nothing is off the table. So here's your opportunity.
Oh yeah, please ask whatever you want.
Okay, so for the people with their videos on, you can just give a little wave that you have a question, and if you have your video shut off, just send me a message and let me know you want to ask a question, and I'll hand it over to you. Who'd like to kick us off? Okay, Hannah, go ahead.
Hi, Jake. Thanks so much for sharing your story.
Hi, Anna.
Hi.
You're very welcome.
My question is, when you describe your story like that, and from some of the posts I read on your website, it sounds like your recovery and progression were very linear, like always getting better in your speech sounds, in your swallowing, in your movements. Is that accurate, that progress was linear, or were there ever times where you would gain a little bit of progress and lose a little bit?
Well, overall, I kept going up, but there were times where, like at Western Mass, they would notice, like, okay, he's not doing so great in occupational therapy this month, but like in speech therapy, he's doing phenomenal. So there was definitely a give and take there, but for the most part, there was always improvements. And there was one point where they were thinking I might be plateauing. Well, there were more than one point, but every time they would say that, within a week later, I would do something new until it got to the point where everybody realized, like, I'm not plateauing, possibly ever. Like, I still haven't plateaued at all.
Got it. Thank you for your answer.
Yeah, you're very welcome.
Yes, go ahead, Wai Ping. Oh, you're on mute.
Hello, Jacob. Thank you so much for
Hi, how are you?
Thank you so much for being here. So, we see
welcome.
a video about the brainstorming. So yeah, so
that was rough.
Yeah, that was rough. So I read the description box. So
Mhm.
I was impressed by one line, quote, you said storming is universally fatal, but I managed to survive. So what is
Yeah.
so it's rare to talk with someone that who really struggled between life and death like you. So
Yeah.
what is like, so it's really like that there's a moment like you really have to insist to live, or otherwise if you're tired or something, you just pass. I'm sorry to use the word, but is that really that moment?
Yeah, no, you're right. Yeah.
Okay.
So yeah, there are two types of storming. One is autonomic and one is sympathetic. And I know that I've had autonomic, and the reason it's typically universally fatal, especially in my case, because my storming episodes, it would sometimes go on for like 18 hours a day, and typically, if it's not from high fever, like it's always like like in really high tachycardia that will like blow to your heart. So, the fact that I had this really for 8 to 12 months, um, at, you know, 16, 8 to 16 hours a day, every day, they were kind of like, oh my God, like how much can this guy take? And it got to the point, in the video they watched, I was definitely fighting for my life. I mean, I don't know if it shows, I was definitely like at the flat effect, and but I remember that video being taken and just being like, oh, like I'm so tired, I want to give up but I can't give up, I don't want to go out like this. And at times when my BP would spike extremely high, there were times it went up like 180ish. What would happen is I would just pass out, and in that moment my vision would go black, and I'd be like, okay, I'm either dead or I'll wake up in the morning. And I would always wake up in the morning. It got to a point where I was like, oh my God, this might be forever. And that was actually a very scary thought I battled with. I was like, I don't want this forever. Like, if this is like as good as it's gonna get, but I'm not gonna die, like, that's terrifying. So storming, was almost, the one other thing that was as bad as storming was inability to communicate, like being fully locked in. That was almost as bad as the pain, and all the pain really came from the storming, because you saw the symptoms, and they're really painful and really difficult. Did I answer your question at all?
Yes.
I'm not even
Yes.
sure.
Yes, that's very inspiring,
All
your
right.
story. Thank you so
Yeah.
much. Thank you for being here again.
Crazy.
Great.
One thing I'll add to that
Thank you.
is Jake, I remember very strongly, and I remember coming home and having conversations with my boyfriend when I got home and being like, how is this guy doing this? His will and his drive and his motivation to fight through the really, really terrible deficits that he was dealt with was absolutely unbelievable to me. I had never seen that level of drive in a patient, and he fought. And like he had said, the inability to communicate, there would be times where he would be dismissed and people wouldn't ask him what he thought or his opinion or what he needed because they didn't think that he could or whatever reason. And Jake would always fight for himself. He would always make it known, I have something to communicate and I'm going to communicate it. And I really think that served you well. And it's really our job as speech therapists to recognize that and scaffold that and support it in any way, shape, or form. I made it my mission every day to make sure Jake was.
I got one thing to add to that.
What?
Yeah.
Go ahead, Jake.
Just one thing I want to say about that. You know, I kind of felt like, you know, it took a lot of work for someone to use the Megabee with me, and it was this feeling of like being an inconvenience to these nurses or like, you know, even my family at times. And it's like, as you know, I had like so much to say and like I had to keep it short and sweet due to like, you know, as a hospital, they're busy. But yeah, it's so important to communicate because when you don't have that, and then when you get a little taste of it back, all you want to do is talk and like non-verbally talk. You know, now that I can verbally talk, I can't shut up.
Who has another question for Jake? Yes, Laura.
Hi, Jake. Thank you for sharing your story.
Hello.
Not just with our
Hello.
class, but with everyone. I really enjoyed watching your YouTube videos and checking out your blog and website.
Thank you.
You're welcome. So I know you mentioned that you had COVID and you've recovered. So that's awesome. Congratulations.
Yeah.
Yes. But how has
Thank you.
COVID impacted your therapies? Like, have you had to go to virtual or like what's been the impact on that?
Oh my God. Disastrous. Luckily I'm able to do a lot more on my own now. You know, like not even speech, like physical stuff. Like I'm able to like, you know, stretch my knees, get into prone, you know, do quadruped, like get this edge of bed by myself. So like for a while everything was shut down for about 3 months. I had like nothing. All gyms are closed. They eventually started seeing people in their rooms, but you know, because my case is so complex and rare, a lot of my therapies are done in outside hospitals, and they, like MGH, Spalding's outpatient, they were all shut down for a while. And a lot of the stuff I need can't even be done virtual. So, you know, things were definitely tough. Here at Tewksbury Hospital, where I reside, we had like a massive outbreak here. Like virtually every single person here got it, including staff. It was so bad the military took over. 94th Augmented Medical Unit of the Air Force took over because there was literally no staff here. So, you know, it was tough. It was very tough. But I kept doing stuff on my own. Like I would do these crunches every day. I would, you know, stretch out my hip flexors. I definitely practiced a lot of speech, literally just talking to Siri. And, you know, I write all this stuff by myself. I do all the video editing myself, and a lot of it, you know, I got pushed to because of the boredom surrounding COVID. So, you know, like majority of my videos I put together during COVID, and like, you know, with these contracted hands, it takes a while to make a decent video. and like I've gotten much better at it. So it's given me time to work on these different areas. And unfortunately, there was like a new outbreak of COVID going on here. Well, all across the country and world, I guess, but like particularly here as well. And they're now saying you might get it again, and it's like, yeah, I had it in April, so I'm due. So, like I said, I got this LSVT voice therapy November 8th. Who knows if they'll be shut down by then, but either way, I'll keep going. There's some sort of app that I'm sure is not adequate or the equivalent to what LSVT can do, but I'll try it out, Anything else I can answer?
Yes, Vi.
Hey, Jake, I just want to echo everybody else and say thanks for kind of taking the time and kind of being so candid with us. Earlier, you said something about, wondering if this is as good as it gets at a pretty difficult point. But then on the flip side, now you talk about how you haven't once plateaued in all of this time.
Yeah.
And I'm just wondering is if you can speak to at what point do you start to realize or know your own potential in the course of this? Is it like a physical feeling? Is it a state of mind? Is it a combination, something else? It's just, it's amazing. And
well, there's a lot to your question. I've actually never been asked that question, so that's awesome. Okay, so, once I broke out of like completely locked in, that was a real eye-opening, they said it couldn't be done. They said I would die. I never died. Then I break out to like being virtually locked in, meaning yes and no by blink my tongue. And at that point, it gave me a lot of hope, and then I get put into Spalding, and I kind of felt like, well, if I was able to do this, like I should be able to do other things that they say are impossible. So part of like the reason my recovery is so difficult is the hospice being put on comfort measures only. My entire system was just weakened and everything became contracted, and is very difficult to come back from these severe contractures, let alone like locked in syndrome. So during my time in Spalding, I always had a good feeling that I would make a remarkable recovery at that point, but there was always that voice inside yourself of doubt, which you tried to ignore, but it's just not a good way to live. Like, you can't have that negative voice or else it'll become reality. So, there were times where I literally cried to Michelle, and I could like audibly cry, but I could not phonate. And we'd be talking on the Megabee, and and same with you guys, remember back, I cried with her a lot about like, is this really like the best it's gonna be? And they're like, well, we don't know, but like if it is, like at least you've come this far, and like there's stuff you can do. And so I never really truly believed that like that was my plateau point at Spalding. And but I did have some doubts, and I was wondering like, could this be my reality? As things continued, like as I got more movement in my body and definitely started to speak, where at least like 5 people in the hospital could understand me. Like, there were times where they would have to call in like a different nurse to like translate. And I don't know how they knew, because it probably sounded like, ah, 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 ah. And like this nurse would be like, oh yeah, he wants to know like if you can change the channel or like something stupid, or like play this band. And as things kept going, I just kept like a really positive attitude, regardless of these doubtful feelings that like you really want to be like shut up to your internal voice that's like, this is like as good as it's gonna get. And so yeah, I had a good feeling it would keep going, and at this point, like where I'm at now, I don't think there's much stopping me, especially after my victory from COVID. They were originally thinking like I might succumb to that. And I was like, no way I came this far to be taken out by like the global pandemic, which may sound conceited because obviously people are dying everywhere, and like what makes me so special. But I'm like, come on, like, it'd be quite fitting with my luck, because a future blog post of mine is how like consistently throughout my life I've had the best luck and the worst luck. So people close to me are like, of course you get this really rare disease that no one gets. Of course you'd end up with locked-in syndrome. Of course you'd be the one documented case of recovery. It's just very fitting. So the idea that I would die from COVID was like, it was like almost poetic in a way, but I was like, no, I will not be taken up by this. I got so much more to do. So yeah. Hopefully that answered what you were looking for.
Yeah, for sure. I think there are a lot of people who could benefit from hearing that. Not just, the few of us.
Yeah.
It's something, it's hard for me to describe.
One thing I'll add to that, like you as speech pathologist, future speech therapist, like you can absolutely make or break someone's will to survive. Like, having Michelle and Rebecca on my time there, they were like massively supportive, and like I don't know, because even though I said I would try and shut that voice up of doubt, there were times where I was like deeply sad and wanted to give up, but they stayed on me and got me through, I believe, the pivotal moment of like, will ever. Because if I was like, no, I'm not doing this anymore, I would have just maybe died. Definitely not gotten better. But so you as speech pathologists can motivate and push your patients to perhaps do the impossible,
Oh man, I don't know how you get any better than that. I just don't. We have time for one more question, I think, if anyone has another question they'd like to ask for Jake. Yes, Grace.
Hey, just to echo everyone again, thank you so much. It's been so interesting learning about you and your recovery. The question I had was about just, I guess, some milestones. You had mentioned when you were speaking earlier that just being able to say I love you was a really big accomplishment. Were there any other words or phrases, or in terms of speech, like any other like kind of big hurdles or milestones that kind of helped push you forward?
Well, again, like a very big, multiple layers to this. So like when I first got on the Megabee, literally just saying like, hot, cold, pain medicine nonverbally was like a huge milestone. Similar to the Megabee, like able to like actually have a conversation where I could like demonstrate my personality. That was a big milestone. You know, when I could say some family members' names, that was big. The I love yous were big. My wife's name was a big one. I remember it was someone's birthday, and I really wanted to learn. I don't want to say sing because I definitely couldn't sing, but I actually have this on video. I kind of like said like, you know, it wasn't singing, but it was like happy birthday, you know, and like that was a milestone. But I would say the biggest milestone was when I could go to an unfamiliar listener, maybe at a different hospital or some outing, you know, some random guy at a movie theater. I was taking to with a recreational therapist. It was like, hey, how are you? And I was just able to have like a very normal conversation with them. And like I was amazed that he like could understand me. I was like, in my head, I was like, holy shit, like this guy knows what I'm saying, like what an accomplishment. So like, you know, when you live in a long-term care facility, it's typically like the same therapist, same nurses, and even if your speech is like, you know, they can understand. It doesn't mean like the outside world could understand. So like people get familiarized with your speech patterns, and like it's fine if that, you know, but like going out to the real world and able to have a conversation with a stranger and be understood, because I was misunderstood for so long, that was huge.
Yeah. Thanks.
You're welcome.
Well, I want to give, we're coming up on 8 o'clock, but I want to give everyone the opportunity, if you have a burning question, to ask it now. We can go over a few minutes if there's anything else you want to discuss or ask Jake. Otherwise, we can wrap up. So I'm just scanning the audience here. Okay. All right. Well, I can't thank you enough for your participation. This, I think, is one of the most valuable experiences for anyone to be a part of, not to mention people who are studying to potentially become speech therapists. You are one of the most amazing human beings I've ever met or had the pleasure or honor of treating. And so I can't thank you enough for what you've done, for what you continue to do just to try to educate people about what you've been going through. I don't know. I can't, you know, one passing comment I'll make about Jake is that, you know, Jake and I didn't speak verbally. We didn't communicate verbally until what, like 18 months ago. The entire time I treated him, we never spoke with each other. Yet we were still able to develop kind of a really nice relationship with each other. And his personality, this personality you see here, came through so loud and clear, non-verbally, using the letterboard and the Megabee. I mean, once I finally started speaking with him, it was like, yeah, this is Jake. I've always known this about him. And so the fact that he was able to be so authentically himself in that really challenging time, both physically and mentally and emotionally and medically, that has always stuck with me, that even during that time and communicating through a letterboard or through a Megabee, which would be challenging for anyone, you were still so you. And I thank you for that.
I've always been me.
Yeah.
It's really crazy when you look at my brain scans, because I should not be me, but it was always me, and I continue to be me. In fact, I'm almost like a better me now. So, well, I mean, Michelle, it's an honor to be here as well. And yeah,
Jake,
thank you very much.
Can everyone, I know last semester students emailed you directly. Do they have access to your email address on your YouTube channel?
Yes, so there's one on the YouTube. On my website, there's a get in touch, and then also like anybody could email me. It's just jhanoverrecovery@gmail.com, same as on my website. And really, I'd be happy to like, even talk to people individually if you guys want.
Thank you so much, Jake.
Especially during quarantine, like, please feel free to contact me. I'm bored.
Well, I hope a few of you take him up on the offer. I chat with him regularly, and it's a highlight of my day. So, all right, everyone, have a good night. Jake, thank you so much. I'll be in touch. Let me know how the LSBT goes. And again, anyone.
Oh, I will.
If you have questions, and enjoy the rest of your night.
Thank you.
Bye, everyone.
Thank you.
Thanks.